Welcome to Yoga Therapy, the Alchemy of Healing. My name is Marie Pampanin. I am your host. Please make sure to hit the subscribe button if you enjoy the information that we're sharing. Thank you so much for your support. Hi, my name is Marie Pampanin, and I have Beth Ashley here. Hello, Beth. How are you?
Good. How are you?
I am well. I'm excited to have you here. It looks like you have this beautiful backdrop of bricks. I love the brickwork behind you. Are you in your studio?
I am. I am in the private office at my studio. So there's a class going on next door. Hopefully, they won't cause too many interruptions.
Okay. I can't hear a thing. Okay, so wonderful to have you. So one of the first questions that I've been asking everybody is about their journey to becoming a yoga therapist and what led them there. Would you like to maybe give us a little insight as to your background and how it brought you to yoga therapy?
Yeah, I started practicing yoga after an knee surgery. I had a physical therapist recommend yoga to me. So I started practicing on the Nintendo Wii at home. And I was just very intimidated to try yoga at a studio for a long time. And I worked with a professional development mentor who helped kind of urge me that direction. And
Nice.
I eventually found a studio that I loved, and the owner was a yoga therapist. And that's when I learned about yoga therapy, and how it's a little bit different than just going to a yoga class. The
Mhm.
classes she taught were all really therapeutic. So it was helpful for my recovery and strength building, and just modifying practice to meet my needs. So I practiced with her for a couple of years before starting my 200-hour yoga teacher training. And then I did that at her school and just kind of mentored with her even after I completed that. Um, and then several years later, I decided to pursue the yoga therapy path for myself and went to Maryland University of Integrative Health, where I met you.
Yeah, which was a blessing.
Yeah, so I ended up with my master's in yoga therapy, and now I'm a certified yoga therapist.
That is awesome. So, one of the things that I noticed immediately is the background with the bricks and asking if you were in your studio space, and you had said yes. So, you are the owner of a studio space. Can you tell us the location and what it is that you're offering?
Yeah, the name of the business is Integrative Yoga Therapy. It's in downtown Easley, South Carolina. So we're just about 30 minutes from Greenville. And we're right downtown. It's a growing area. There's a lot of people moving to Greenville and the outskirts. Um, but this space has been open now for 10 years. I bought it 2 years ago. So I bought it from my mentor after she retired due to some health reasons. And we've got a lot of stuff going on here. We've got so this private office where I am now, there's two more offices like this that we have an acupuncturist and a massage therapist in. And
Mm.
then we have the larger space where we have mat classes. And then we also do aerial yoga. So we have a room just for that.
That's exciting. Aerial
Yeah.
yoga.
Yeah.
We'll have to chat about that later.
Yeah.
So, in terms of your offerings, with classes in the aerial yoga, is there anything that you're doing in terms of therapeutic yoga? Are you offering clinics? What does that look like?
Yeah. So I'm doing mostly one-on-one yoga therapy sessions right now.
Okay.
Um, I have done some small group therapy classes as well. One of the projects I did in school was a yoga therapy workshop for chronic pain.
Mhm.
So that one is one that I continue to offer um, because so many people suffer from that and
Yeah.
have myself as well.
So when you're doing your one-on-one work, if somebody was new to yoga therapy, what are some of the things that they might expect to see?
The first time they come in, I tell them it'll be a little longer appointment. We'll go over their health history. So they have some paperwork to fill out, like they would if they went to a doctor's office. And I'll review that before I meet with them and then just kind of mark things that I want to highlight and ask more questions about in person. So we'll go through all that together so we get a nice, complete history. And then we also ask about other areas of their life. So socially, and what are they doing for fun? What brings them connection and joy?
Hmm.
We also do a breath assessment the first time we meet. So we'll look at their patterns of breathing. And a lot of people have kind of a dysregulated breathing pattern. So we'll work on ways to just improve it for better overall function and to help
Hmm.
regulate the nervous system. And then we'll do a physical assessment as well to look for musculature imbalances where they might have areas that are tight or weak or just need to relax.
Yeah. So this is one of the things that most people, when they come into yoga therapy, they may not realize that they're coming into the assessment, the assessment, the breath assessment, you know, the discussion of any medical issues that they might have. Um, we know that because that's what we're doing. Uh, but if somebody did not know that, what might you preface your session with so that they aren't like, well, why is she asking me medical questions? Why is she having me do all of these assessments? Because
Yeah,
for some people, they might be going, well, yoga therapy, we're going to be doing yoga together, which is something that I commonly hear. I don't know about you, but
yeah. So I often ask them about their yoga background first, if they've had any experience with yoga. And then I explain to them that while a lot of Westerners, especially, see yoga as a physical practice or an exercise, it's a lot more than that. That's just one
Mhm.
component. So we've got lots of other things that we're going to go over, including the breath, including some philosophy,
Mhm.
um, and meditation, just to kind of give them an idea of what to expect.
Yeah. Have you had anybody ask you about the philosophies and how that affects the sessions that they're coming into?
I
Because there's
have,
also they might some people might think that it's more spiritually focused, is what I'm thinking.
yeah, I have had, especially the students from my chronic pain group, show a lot of interest in the philosophy aspect, and they said
Mhm.
that has been really beneficial in kind of putting the whole picture together for them, and understanding it's a mind, body, spirit practice. Yeah.
Yeah. So if we kind of break that down a little bit more, what are some of the things that they might see? Let's just start with the energetics. So you briefly have touched on that already. So you were saying the breath work. So what might they see if they're coming in and they do their breath assessment and you notice that maybe there's a little bit of dysregulation going on? How would you preface what you're going to be doing and what might they see and experience?
Yeah. So functionally, I'll explain to them that a lot of people tend to have a shallow breath, that they tend to breathe more in the upper chest, and not use their full capacity of their lungs. So a lot of times I'll have them just bring a hand to their belly and a hand to their chest just to help them feel that breath and notice where they're breathing. I have them bring their hands to the sides of the body to see if they can feel that expansion left and right, and ask them to explore that front to back sensation as well.
Mhm.
So we're looking to see if we can feel the torso moving in all directions. I'll use the image of a balloon filling with air. If you inhale, can you feel it expanding outward as if you were filling a balloon? If you exhale, can you feel it contracting, like you're gently deflating that balloon? So I want them to really feel the breath. A lot of times we are just breathing all day and don't notice the breath at all.
Mhm.
I'll have them picture the diaphragm. I explain to them that it's this big dome-shaped muscle at the base of the lungs. And when they inhale, it lowers down toward their pelvis. And as they exhale, it's going to rise back up toward their heart. So I
Mhm.
think just visualizing that can help as well. Um, and then just looking to find those more balanced breaths, looking to balance out the lengths of the inhales and exhales,
Yeah.
or particularly lengthening the exhalations to kind of upregulate that parasympathetic nervous system, rest and digest.
Exactly.
Yeah. Um,
I
I'll also
do
talk about
often
the
find.
values sometimes too. So not just,
Say
physically with the breath, but with the prana, I'll explain to them
that.
things about prana being about that, in not just inhaling, but about what we're receiving,
Yeah.
mentally, emotionally. And then apana is about letting go physically, emotionally. We'll talk about sabana, that digestive
Hmm.
pathway of the prana. We'll talk about the udana vayu, about our articulation and communication and listening.
Hmm.
And we'll talk about the Vayana Vayu, about that circulation in all directions. So
Yeah.
we'll explore a lot with the breath.
I'm really excited that you just brought up the values because I've brought them up before, but it is not something that I would normally speak into. It's more of a noticing for me.
Mm-hmm.
Um, and so as you were bringing that up, I was thinking first, for anybody who might be listening to this podcast and it's the first one that they've ever listened to, prana would refer to breath, our life force. Um, and then you were speaking about the different variations of the winds through the body. Um, so for anybody who's like, well, what was that?
Yes. Yeah. So it's not just the physical breath, there's that
Yeah.
whole animation, of
Mhm.
our spirit.
Yeah.
Yeah.
And I really love the values because I remember when I first started reading up on them myself personally, it really struck me because I would hold my breath a lot. I would, kind of shallowly breathe. And once I understood the values, then there became more of this opening of breath. So maybe we can explore the values just a little bit more. So you went through them pretty quickly. Maybe
Yeah.
just go back a little bit because I do think that this is a good piece for people to understand that the breath work, it, I want to say that most of the people that come into my practice, if not all of the people, off of the top of my head, every person I work seems to have some dysfunctionality when it comes to the breathing. They're very dysregulated. It also works, specifically with a lot of trauma. And so there's going to be a lot of that dysregulated breath. So you were already, speaking about prana, so bringing in the breath, right? So if we were to say notice, or somebody were to notice that um, maybe like me, holding their breath, and maybe in between holding their breath, it's more shallow. How might that translate in therapeutic yoga?
Yeah, I agree. I work with a lot of people with breath work, and I don't know if I've ever met anyone who hasn't needed some help with breath work. We just get into our patterns, and it's hard to break them. Um, and holding the breath can actually kind of increase anxiety. And I don't think a lot of people realize that. So the kumbhaka is the breath retention, and it's actually kind of contraindicated for people with anxiety. So there's some really great practices that use it, where you're doing the box breath, maybe inhaling to a count of 4, holding that for a count of 4, breathing out to a count of 4, and then pausing there for another count of 4. That can be a really calming, soothing technique for a lot of people. But I think it's important to realize that it can also be triggering or kind of dysregulating for some people as well. So sometimes just practicing those different techniques and seeing what works for you or what doesn't is the way to go. So we can't really generalize anything with yoga therapy. It's all an individualized practice. So there's no right or wrong way, just to explore it and see how it feels. So if it triggers you, if it causes that anxiety, then we would just avoid that. If it is that counting that's calming and soothing for you, then we'll bring it in.
So what would be some other things that, if somebody were holding their breath, having shallow breath besides breathing, that you might bring in to their session with the knowledge of, we're working on goals together, we're working collaboratively?
Yeah, we might work on a counting breath that doesn't use any of those breath retentions. So it might be breathing in fully to a count of 4 and breathing out fully to a count of 6, and looking to really focus on that full expansion of the rib cage and feeling that breath in all the parts of the torso. Um, just looking to get out of that pattern of holding the breath or those shallow breaths or whatever it is that particular person has going on.
Are there any other things that you might try, like maybe a body scan, or
Yeah.
a mindful practice?
Yeah. So I do use body scans a lot. Sometimes taking the focus away from the breath can actually help regulate the breath. If it's really challenging for a lot of people to do breath work. As soon as you bring your focus to your breath, it's like you automatically want to change your breath. So sometimes we'll start a practice with just notice your breath and try to not change anything. But even just
Mhm.
telling them to try to not change anything, they're automatically going to change the breath. So if instead of telling them to focus on the breath, if we can tell them to focus on a sensation in the body, and then maybe just scan through different parts of the body. So I might say, notice sensation in the toes, notice sensation in the sole of your foot, your ankle, your leg. We'll work our way up, all the way up to the head. And by the time we get there, you'll notice their breath changes, even though we're not working on the breath. So that's one of the really great things about yoga is it's all encompassing. So there's these different bodies, or koshas is what we call them. So the prana maya kosha, that's the breath body, or the energy body is one of them. But we can change that by things that we do in the physical body.
Mhm.
So sometimes just moving through a practice, if we do like a really basic sun salutation, like an inhaling to reach our arms overhead and exhale to bring our arms down by our sides, just moving the body in certain positions also can have effects on that prana and on our breath. And then the meditations we go through, same thing. That's another kosha. So the mental body, scanning our emotions, the emotional body. So they're all like interconnected, and what we do in one is going to affect the other.
Mhm. And that is something that I was kind of working towards there,
Yeah.
in case you didn't catch that. Because, many of us, I think, work a lot with breath.
Mhm.
But there's so many other pieces that connect to why somebody might be holding their breath, why somebody's breath might be shallow. And I've found and within my own practice that some of what I'm seeing is that people have this disconnect between their body, and so if you ask about their breathing, well, I breathe all the time. That's one of my favorite moments.
Yeah.
Well, I'm breathing right now. It's like, okay. And then when you have them check in, they don't necessarily feel, where the breath is going. And so, yeah, we do use hands to help so that there's that immediate feedback of, oh, do you feel the rib cage? Well, no, I don't feel it. Okay. Well, if we put our hands around it, or if we, bring the yoga strap, like, can you now feel as the rib cage starts to float out? Um, and then there's that piece of why. Like, why is there that disconnect? Why are we in this state of dysregulation? Um, and so I know, like you, I do, a lot of body scanning, having them check in with their body. I happen to live in an area that's very woody, and so I will often have people look outside and look at a tree, as they're focusing in on their breath, because that does help to regulate their nervous system. If I could bring my dog in, I would, but I try to keep her separate from the practice. Um, but I have noticed that people can definitely move into more of regulating their nervous system if they're not looking at me trying to fill in this, like, oh, yeah, I do feel something, but no, I'm really not feeling it.
Yeah.
And I love that you brought in the mental piece because, again, how do we, end up where we can't breathe? Our breath is shallow or we are holding it if we're disconnected from the body. How do we make that connection? And sometimes it's befriending the body. Sometimes I like to use the phrase, childlike curiosity, right? So if we're not attaching storylines to things, how do we explore, right? I know that you happen to be amazing at meditations and scans. I'm having listened to several of them and been a part of them, which I think, again, can be really useful for people to connect back into their bodies because it's almost like this is how I like to think of meditations personally. It's the meditation gives my mind something to focus on, to hang on to instead of my brain going and racing into what do I need to do? What questions am I going to ask Beth? Right?
Yeah.
It gives me something to focus on, and then that will just bring me right into the present so I can start to address certain things. And the clients that I'm working with, have similar experiences. So one of the things that, I'm really hopeful that we can bring to people's awareness in terms of what yoga therapy is what they're going to see, what they can expect, and some of the words that we use might come across, you know, a little strange because we do use Sanskrit words sometimes, like the Vayus and, all this good stuff. So being able to translate that so they know that when they come into a session, we're looking at them as a whole and all the different pieces, that kind of intermix to make them who they are, and then, let them guide and co-collaborate with us, which I know again that you're really awesome at. So when somebody comes in, um, and they do fill out the paperwork, say they don't have any goals, what might be something that we could do or you do to help them to create goals? Because I think goals are pretty important when you're coming in to see somebody.
Absolutely. Yeah. So we might just figure out if there is something in your life you're looking to get to, even if it doesn't seem related to yoga. It might be, working on your master's degree for nursing, or, something that doesn't seem at all related to yoga. But we can usually figure out some sort of way to create a goal, to get you to whatever it is you're working on. If I see particular muscle imbalance, I might let them know, I see this, and let them know how it can affect the body, and say, does this affect the way you do your chores at home, the way you enjoy your weekends with your family? So things they might not typically even realize that are having much impact on them.
Yeah.
So we'll just figure out what's most important in their life, really. And once we find out what their important thing is, or their meaning and purpose, maybe we work around that to create some kind of a goal. Because
Yeah.
everybody's got something they're connected to.
Yeah. And I love that you just brought up meaning and purpose, because that is something that we do also connect with our clients. You
Yeah.
know, I don't know how often you come across people who don't necessarily know if they have a purpose, or they're struggling with this idea of purpose. What is purpose? Um, do you actually have that happen in your practice at all? Yeah.
Yeah, I think a lot of people don't necessarily have that. It's not necessarily something everybody considers, and that can be a meditation practice on itself. Is what what are the things that bring you meaning or purpose?
Hmm. And why would that be important for somebody?
That's gonna just help them to find what brings them joy and brings them just a better quality of life overall. If we can figure out what direction they're wanting to go, we can figure out a lot of different pathways to help get them there that they may not have even considered.
Yeah.
Yeah.
Um, One of the things that I was thinking earlier when you were talking about chronic pain is that, you know, having dealt with chronic pain myself, and I know that you've also had this experience, sometimes we can get so caught up in the sensation of chronic pain and maybe lose hope, lose faith, lose our direction, maybe lose the purpose of why we're even here. We're so, impacted by the amount of pain that we're experiencing on a daily basis. How does yoga therapy help with somebody who might be experiencing chronic pain?
Yeah. When we're having chronic pain, a lot of times it's almost impossible to get our mind to go anywhere else. It's just so focused on those sensations of pain. So physically, we can try to get them to explore other sensations. Maybe it's just feeling temperature, what's hot, what's cold, what feels light, what feels heavy, and giving their brain those kind of neural connections that can say, oh, yeah, there are other sensations. Um,
Mhm.
and then sometimes just acknowledging that pain. saying, oh, you're there. I hear you. I see you. That can kind of turn down the volume on that pain a little bit once you start to make those connections. And then just having that like social connection to other people. That's why I really like the small group practices for the chronic pain groups is
Yeah.
when they meet other people that are going through similar situations, they can talk about it together. And just having that like felt sense of connection, knowing you're
Mhm.
not alone, can start to just change how we interpret that pain.
Yeah.
So pain is there. It's usually our body's trying to tell us that something's wrong, and it's there for a reason.
Yeah.
But sometimes it gets turned on and is almost impossible to turn off, even after your body realizes there's something there. Or sometimes maybe there's not something there. I've worked with people with phantom limb pain, so it's this
Mm.
body part maybe that's not even there anymore. And they're still experiencing that sense of pain in this finger that they no longer have.
Yeah.
Um, so just kind of acknowledging that pain is one way, and then our meditations that just turn our mind to something else, even just for a few minutes. If we do that enough, then it's easier for us to keep getting back to that point and getting away from that narrowed focus on that pain.
Yeah. So speaking of phantom limb, you have some special training.
I do. I have training in yoga for amputees. So my mom is a baloney amputee, and after she lost the lower part of her leg, I knew that there had to be some kind of yoga therapy that could help her. Luckily, she never dealt with the phantom limb pains, um, but she did have difficulty just adjusting to everyday life, getting up and down from a chair, getting up and down from the floor, um, getting in and out of the shower, taking on and off that prosthetic leg. It's a whole new life to adapt to. So I took her to her training at Yogaville and met the founder of Yoga for Amputees, Marcia Therese Danzig. Um, and she actually taught my mom how to get up and down from the floor because that wasn't something that she even learned while she was in rehab. And it's come in handy for her. She's fallen out of her chair or out of her bed and had to get up while she was the only one at home by herself. So, um, things that she learned in her yoga practice help her, you know, in other parts of her life as well.
Yeah.
Yeah.
The one of the things you brought up was, her having the ability to get up on her own. And I'm so happy that when she's had you there and have the foresight for you to go, what can we do to support you? Which again is very therapeutic. One of the things, we do as a yoga therapist. But, for your mother, and I'm sure other people that may be amputees, one of the things that I imagine that they maybe one of their struggles is not just the ability to get up and down, but then feeling like that they might be a burden, feeling that loss of autonomy, feeling, less than, right? So, how does yoga therapy help with that?
Yeah. I think it comes back to that idea of wholeness. So knowing that we're not just our physical body, that we've
Hmm.
got all these other bodies. We've got the breath energy body, that emotional body, that
Hmm.
intellectual body, that spiritual body. And that's what makes us a whole, complete person. Just exploring all those other things. I think a lot of times we get too narrowed into that I am my physical body or I am my thoughts or whatever it is you get focused on, it's hard to see that whole picture.
Mhm.
And then especially just realizing our true nature, so that we are this overall observing um, capacity. We are just there to observe what's going on in all these different bodies. We are that spirit that is the witness to all of those things going on. Um, just coming back to that idea of who we really are as that observer can help kind of get away from that we're not complete or we're not whole.
Yeah. Which brings me right back to purpose,
Yeah.
you know. We can still have purpose. We can still affect change in the world, and bring our gifts with us despite any limitations. And I think that's an important piece to recognize, no matter what the limitation might be, is
Yeah.
that, whether it's an emotional, physical limitation, we still bring a gift into the world and we still can affect change within ourselves and outside of ourselves. So that's pretty amazing because that's pretty much what you've done. Especially in helping your mother. And I did have the opportunity to meet her, and she's an amazing woman and an amazing daughter. Um, okay, so is there anything else that you are certified in that you would like to share with us?
Sure. I also have a certification in Curvy Yoga. So that's working with bigger bodies, um, people with curves. So it could be women. I do work with a lot of women, but also men that feel like maybe they can't practice yoga because they have a bigger body. Um, and that is really common, unfortunately, um, especially with what we see on social media or
Right.
in the media. A lot of times it's young, skinny, white women, you know,
Hmm.
and people think if they're anything but that, they can't practice yoga. Oh, I'm not skinny enough. I'm not flexible enough. I'm not strong enough. Whatever the kind of thing they're telling themselves. I I like to help people see that anybody can practice yoga. So any size, any race, color, ethnicity, background, whatever you have going on, there's no reason you can't practice yoga.
And culturally, and historically, yoga, it started with men.
Yeah,
Men were
absolutely.
practicing yoga. And so I think that's an important piece to also bring in because a woman's body is very different and we age differently as well. And so to bring in a model that is inviting for all bodies because yoga has so much to offer, especially in terms of, breath work that you brought in earlier, because you're right. We connect the movement to the breath, often in yoga. So even though people um, may experience, the holding of the hands on the belly and the rib cage in a therapeutic um, class, workshop, one-on-one. They may not necessarily think about it when they're in a class, a generalized population class, but that's what we're doing. We're connecting to our breath. And it has a natural pattern to it. So, like you said earlier, if you're inhaling up, exhaling forward fold, I myself actually picked, I'm like, when I'm doing yoga, I actually breathe much more.
Yeah,
Because if you think, somebody who's breathing shallowly, they may not notice the state of the breath. But, if you're in a class and it's inhale, it takes you time to get up to, mountain. When you exhale, it takes you time to get into forward fold.
yeah.
We naturally start to pattern the breath in our practices, also known as asana. So, uh, one of the things that I'm wondering if someone were to say, well, what's the difference between a curvy yoga and a non-curvy yoga? Or what if I were to come in and I am an amputee, or what if I do have chronic pain? What are some of the things that they might hear you or any of your, instructors say as they come in and join a
Yes.
yoga class?
Yeah. So when they get here, we show them our props. So we tend to use a lot of props in our class. And I don't really like the name prop. I feel like it kind of has a negative connotation. Like people think they're propping against something. Like they have to have it as like a crutch or an aid. Like they're lesser than if they're in a pose using a prop. Um, so I like to invite them to grab all the props, even though we might not use them all. I'll say have it just in case. And then when we're in class, we might explore different variations of a posture. So I might instruct them to, okay, try it with this prop. Okay, now try it without this prop. And then they can
Yeah.
start to see why we're using the props and how it can actually get them, deeper in a pose or in a better alignment in a pose or find a better sensation. Um, or just find a variation that works for them. So when I'm teaching a group class, we'll take a lot of different variations and I'll invite them to explore them all. I'll use a phrase
Mhm.
like maybe you try this or perhaps we do this. So
Yeah.
I'm going to invite you to explore this. Um, and I just want you to see how it feels in your body and what resonates with you. And if you find a variation that really feels good, then that's your
Mhm.
yoga. And anytime you hear to do this pose in a class, you'll know that this is the way you do that pose. So if you look
Yeah.
around the room, everybody might be in a different variation of the same pose and know that we're all not going to look the same and we are going to have our different variations.
And I love that you said your yoga,
Yeah.
you know, your yoga. I think that's an important piece to explore here, whether somebody is coming into a yoga class for the first time, or they're coming into yoga therapy or a yoga therapy workshop, right? Is that it is their practice.
Yeah.
It is their healing. It's what they need it to be. Sometimes I think that, you know, so we're trained to work within the Western medical system. And I think that what somebody might find when they go to the doctor is, oh, you need to do X, Y, and Z. Here's your protocol, do X, Y, and Z, where we explore what feels manageable, what helps them to attain their goals, their desires, their wishes, their spiritual growth, their emotional growth, their physical growth, right? I think that's a really huge piece of what yoga therapy is. So when you say your yoga, you mean that.
Yeah.
Yeah. Which is awesome because we get to meet people where they're at and they get to meet themselves where they're at. They don't
Yeah.
have to strive to be something or do something that is not them today. Maybe
Absolutely.
tomorrow it might be, right? Or maybe that's the way it was 20 years ago. I know as an aging woman, sometimes, especially because I do, still work within the fitness industry, it is really challenging to find my body moving into areas that I wasn't expecting it to because I work out all the time.
Yeah.
I stay healthy. Well, things do change. But one of the things that I've also have learned with yoga therapy is to have compassion and empathy for myself and to meet myself where I'm at, which has actually, in a lot of ways, made me a much better instructor because I'm not pushing people into spaces that they're not ready to go. We all go where we need to be in that moment. And consequently, some of us are getting stronger
Yeah.
and not in so much pain. I just laugh because when we met, I was having chronic back pain, which is out now subsided. And then I ended up with a knee thing. So,
Oh yeah.
and that's another piece that I would love to explore for a few minutes with you as well is, sometimes what we might find when we are dealing with chronic pain or we're dealing with things that may not appear to be specifically related to a postural dysfunction, is that there can be a shift. I don't know. Have you had that happen with any of your clients where they come in for back pain and the next thing you know, something else is hurting, but their back
Oh
is
yeah.
fine now?
No, I felt that myself. It's a different pain every day. I'll wake up one day and my back hurts. One day it's my knee. I have arthritis in a lot of different places and a lot of other injuries and health problems. So the brain really can only interpret so much,
Hmm.
so many signals at once. So it is funny the way pain can tend to jump around. I know personally exactly how that feels.
There's a podcaster out there that his title for his podcast is Chasing Pain. Like, sounds like me. So that is really something that's good to know that the brain does take in different information. Things might change, which brings me back again to breathing and inflammation and how the body starts to process. So maybe we can explore that a little bit because I do believe that there are a lot of people that are out there dealing with chronic pain, as well as some of the other issues that we've talked about. So knowing that they can come in and be in your studio space and feel safe to be seen, to be able to work on goals that they themselves want to achieve. It's not because somebody told them to do it, but in their healing practices, some of what they might begin to experience as the autonomic nervous system starts to become more balanced is less inflammation.
Yeah, definitely.
Yeah. Um, there's a couple of things that also kind of spring to my mind as well is it's not just that, less inflammation, but the hormones that start to come into play. Um, I'll pass it on to you if you want to speak into that a little bit before I move into what else the breathing can do.
Yeah. Oh my gosh, hormones. That's like a whole nother story.
Yeah.
um, but yeah, it's crazy the way you know, something that seems so minor, a hormone can affect everything with our body,
Mhm.
and with our mind too,
Yeah.
emotions.
Yeah. And that's where I'm going to jump to next, but I thought we could hit this piece first
Yeah.
because I'm not sure that most people might be aware that when we affect the breath and we affect the nervous system, that we're also affecting the brain, which is going to impact the hormones. Um, and what I was going to jump into next. And again, feel free to pop in, whatever you want to share things, is that when we start to regulate the nervous system, there's this beautiful thing that happens within the brain too, where we start to use more of it. Would you like to maybe share your thoughts on that?
I'm not sure. I'm
Like,
really not sure where you're going with that. I'm sorry.
so when we regulate our nervous system, I'll just go
Yes.
like this right
Yeah.
now. And then I'll let Sean kind of splice that back in. Um, so, in regulating our nervous system, the amygdala starts to quiet down. We start to
Yeah.
use more of our prefrontal cortex, which it's very calming, not just for the physical body, but for the mental mind. Would you like to say anything about that?
Um, I don't know. Not really.
Okay.
Yeah.
Okay. Oh, there we go. Um, okay. So with everything that you've been doing, is there anything else outside of the studio that you want to share with us?
Um, so I am working to collaborate with a local physical therapist right now. We are going to do
Some,
a workshop on the pelvic floor.
that's exciting.
Yeah, I'm really excited about that. I've I've had pelvic pain myself, so that is something that's near and dear to me, and undergone a hysterectomy and a lot of different just womanly issues. And then the pelvic floor is so interconnected with the breath too. So I'm really excited about what we're going to put together. Um, yeah, I just can't wait. I don't have a date yet, but it is in the works.
I'm excited to hear about that. I'd love for you to come back and maybe talk a little bit more about the pelvic floor. Being in the fitness industry, there's a lot of um, hypertonic pelvic floors, um, which I would say as early as like 5 years ago, I had no idea. I had no idea how much the pelvic floor affected it, our core. It's part of our core muscles, but it is an important piece for both men and women to be aware of that we can have either a hypo, so more of a not functional pelvic floor, or a hyper, so it's overly active. So that is really exciting that you're going to be doing that.
Yeah.
How did that come about?
Um, I I met some of the ladies that own this physical therapy practice at a wellness event that I went to. So they invited a lot of healthcare practitioners from our area to their space to set up tents and information booths. So I had one about yoga therapy, and one of the ladies I met there is a pelvic floor physical therapist, and she's been to some of my classes and realized, how much of what we do is related, and realized
Great.
that we could probably offer things to help just bring it more together and make the people at my studio aware of what she does, and she's hoping to make some of her clients aware of what we do here, and just kind of benefit the whole community.
That is awesome. Congratulations.
Thanks.
I know that there's some wonderful pelvic floor yoga therapists out there.
Yeah.
And I'm looking forward to anything that you might be putting out there as well. So if anybody's interested in pelvic floor, we know to come knocking at your door.
Yeah. I'm also doing a workshop with a local doctor. So she practices lifestyle medicine, and she recommends a lot of her clients to me as well. Um, so she tries to practice more of a preventative approach to healthcare. She's not just like reacting when you have issues, but she's trying to help make dietary changes and changes with our physical activity to just find better overall health, to help get people off of medications. She's trying to get more people off of them than she is
Yeah.
prescribing. um, so she's also doing this series at her place. She has a wellness kitchen at her doctor's office where you can learn how to
Wow.
cook healthy meals, and she's invited some local healthcare practitioners to put on this series of just kind of teaching the community. So she asked me to come in and teach something for her as well. So I think we might be focusing either on chronic pain or stress management when I do that one.
Mm. stress management. I
Yeah.
think we use a little stress management.
Everybody can.
Do you want to say anything about some stress management, what that might look like if they were to come to you? Because I think that almost everybody could probably use a little bit of stress management.
Yeah. So I love, breath work and meditations. I also have people do things like journaling, or I've had people um, do like color therapy where they're using their coloring books to kind of meditate and just
Oh,
take their mind off of whatever's going on outside for just a little bit and just kind of turn into something else. I've had kind of pet therapy where I ask my clients to just pet their dog, pet their cat, go out in nature, go for a walk. Um,
yeah.
so yoga therapy can be a lot of things that are not physically on the mat.
Yes,
Yeah.
absolutely. I like to think of yoga as something that we do all day.
Yeah.
It's a lifestyle. It really is a lifestyle. Um, and I say that because, as you pointed out, the breath, the movement, the mindfulness, whether it's in journaling, walking, petting our dogs, being present and having conversations with our friends, being present and having a conversation, with you, right?
Yeah.
Being able to stay present when somebody's talking, being able to self-reflect, being part of community, and understanding the importance of being part of something that's greater than ourselves. So this is definitely a piece of lifestyle. Yeah. Yeah.
Yeah.
Beth, thank you so much for joining me today. I really appreciate all that you shared. I'm super excited about hopefully one day coming back and revisiting the pelvic floor
Yeah.
because that's not something that I have done a lot of work with. So that is definitely something that I think that there are people out there that might be interested in. So
Yeah.
thank you. So we will have all of your information in the show notes, but maybe you can let us again just repeat really quickly. Where can we find you?
Yeah. So our website for integrative yoga therapy is iyt.yoga. You can email me at info@iyt.yoga. Those are the best ways to contact me is just through email and respond as quickly as I can. I have a Facebook and Instagram as well. If you search for integrative yoga therapy on there, you should find us. And there's links on our website as well.
Nice. Do you also do any Zoom? So if somebody is like, oh, I just love her, but I don't live in South Carolina,
Yeah,
uh, do you do any Zoom work?
I do. I offer individual yoga therapy sessions on Zoom.
Awesome. So amputee, curvy yoga, chronic pain, um, pelvic floor. Am I missing anything? Oh, stress, stress,
Yeah,
nervous system regulation.
absolutely.
Did I cover everything?
I think that's a good base. Yeah.
Well, thank you again. It was wonderful having you. Hopefully, we'll get to talk to you soon about the pelvic floor.
Awesome. Thank you.
Thanks. Talk to you soon. Thank you for joining us today. If you would like to support this content, hit the like button, subscribe, or leave a comment. Thank you so much for joining us. Have a fabulous day.